Good morning. Calling to order the Board of Health meeting for the town of Shrewsbury. Today is July 26th, and the meeting is called to order at this point in time. I'd like to propose that myself, Dr. George Abraham, be appointed as acting chairman for the Board of Health for this meeting. Ms. Rosacci?
Approved. Second.
Okay. All in favor? Ms. Rosacci?
Aye.
Abraham, aye. The motion is approved. And with that, we'll review the minutes of the June 21st, 2024 Board of Health meeting. I'll make a proposal to accept them as written. Ms. Rosacci?
Second.
All right. All approving yes. Ms. Rosacci?
Yes.
Abraham, aye. The meeting minutes are approved. Our next agenda item is the communicable disease update. I'll turn it over to Ms. Solo Dennis of the Worcester Regional Public Health Alliance to tell us about any updates to the communicable disease issue.
Good morning, Mr. Interim Chairman. I will ask my colleague, Ms. Amelia Halton, to give an update on the communicable disease update.
Hi, everyone. Good morning. So in terms of the month of June, the communicable diseases of interest would have been COVID. COVID was up slightly between May and June, as we have seen with the bio-waste analysis. And then, because this is closer to the end of July, I can tell you that between our last meeting in June and today, there was a very slight uptick from then as well. And that could be, even though in the middle of June, the biobot analysis showed a decrease, we also had the 4th of July holiday. So that created a little bit of an uptick. And flu, very few cases this time of year. We have not had any measles, despite the global reporting of outbreaks. And that's it for the actual communicable diseases.
And I'm assuming that there is no uptick in activity of West Nile virus or Eastern equine encephalitis or any of the mosquito-borne illnesses?
No, there were a few positive mosquito samples in Worcester, but those are just samples. We haven't seen any cases come through our electronic reporting system, because if we had, we would know about it as soon as the state knows.
Right. And I think hospitals also have not seen a major uptake. In the community, we've seen some increase in COVID, primarily from travelers, people who've traveled out of state and come back, etc. But otherwise, no major uptick yet. But there are spots, even in hospital, we have clusters. Ms. Rosacci, in your institution, about the same?
Same as well. Mm-hmm.
Yeah. Okay, great, thank you. Are there any other questions? All right, hearing none, we'll move on to the Central Mass Regional Public Health Alliance report.
At this time, Mr. Chairman, I will ask Emma to give an update on the regional inspection work that is done in the town.
Thank you.
Good morning.
Good morning.
Since our last meeting, we've done 71 total inspections, including addressing complaints that come through. We do have a lot of new restaurants coming to town, so part of that is a health plan review, making sure that all the equipment is commercial grade. They have proper sanitation policies and sick policies in place prior to opening. So we have worked with a few of those restaurants that are at that stage, but we do have quite a few more that are at various other stages. So we anticipate, hopefully, that those will be coming through soon. The rest has been, as I said, addressing complaints that come through, providing education, and referring resources as best we can to solve some complaints that might come.
I was noting one of the stores which has expired foods. What's our usual protocol for determining whether there's expired food that's still being on the shelves?
So at that establishment, I did go through with the person in charge. I did ask what their policies and procedures are for checking dates and removing product. In that case, some establishments accept returned product, and it ended up back on the shelf. So I did provide education that that's something that can't be done. As far as produce and things, a lot of establishments have their delivery personnel check through as they're restocking the shelves, so they will pull anything that is bad at the time of getting new product in. So the grocery aisle, so to speak, is where they have to kind of have more eyes on that product.
Great.
I did have one question about the foodborne illness. Was that confirmed? That the person actually was sick and you inspected, or?
I am not sure. When I receive the complaint, I go to the establishment to confirm the conditions. So we try to trace back the food as best we can. We want to know how long food is in the establishment for, from the time it's received to the time it's prepared to the time it's at the table. So that was a conversation that I did have with that owner, looking through, I believe in this case it was seafood that the individual had. So I wanted to know how long it's stored for, how are they checking temperatures frequently, and to make sure that it's cooked thoroughly.
Perfect, thank you.
Great, thank you.
There was a case, a foodborne illness case, which was probably related to that event. We've had very little foodborne illness in the last few months
Yeah,
here.
understandable. Great, excellent. Any further questions? If none, reviewing a meeting schedule, does August 30th look good for you in your calendar?
Yes.
Let's,
Carrie, does that work for us?
so August 30th is early voting for the state primary, so this room will be booked.
Okay, do you want to go the week before?
The 23rd is available, and August 16th is available.
I can do the 23rd.
23rd? I'm fine with the
23rd?
23rd as well.
23rd?
Okay.
Yes, I can do that, thank you.
Great, 23rd at 8 a.m. Right, if there are no other agenda items, we can, Mr. Dennis?
Mr. Chair,
Yes, please.
I just want to introduce my colleague, Ms. Cherry Chandri, who is in attendance today. Cherry is the new shared service coordinator. She'll be working with the Alliance Towns, making sure that we are in compliance with our federal deliverables, our state deliverables, and also making sure that all line staff have the core competencies to carry out the core public health functions. So, Cherry, if you can introduce yourself.
Hi, I'm Cherry Tangri, and as Solo said, I'm the new shared services coordinator. I look forward to working with you all in this new capacity. I was the tobacco enforcement person as well, but I continue to be the interim tobacco for the Alliance Towns until we hire a new coordinator.
Great, welcome.
you.
Welcome, we look forward to working more together. Great,
Yeah.
thank you. Great, with that, if there are no further objections, we'll move to adjourn. Ms. Rosacci?
Approve.
All right, Ms. Rosacci votes aye, Abraham votes aye, the meeting is adjourned. Thank you very much for everyone's attendance.
Thank you.
Thank you.
Thank you.